Here we're going to be talking about opioid misuse, abuse, and addictions, and the health concerns that come along with it. To start out, we're going to be talking about the description of the population that is most likely to misuse and abuse opioids. One thing is that addiction does not discriminate, and any individual can experience addiction in their lifetime. The individuals that are most at risk who have an addictive personality. Characteristics of an addictive personality include risk takers, if they have history of a mental health disorder, if they are obsessive in nature, or if they are just disconnected from either their life, their family, their job, anything. The size of population that is affected by opioid misuse and abuse is actually pretty significant. Locally in Ogden, I discovered that Ogden is considered a hotspot, which means that throughout the state of Utah, they have designated certain hotspots for opioid misuse and abuse, and Ogden is one of the ones that experiences the highest death rate of 39.1 out of 100,000 individuals. Statewide, Utah had 456 opioid overdoses in 2017, and then nationally, there were 2 million Americans that misused opioids in 2017. Now, this could be people that are getting them illegally, people that have a prescription for them. Internationally, 275 million people used drugs in 2016, which is very significant. Now, the surface area of Utah is a lot larger than most states, and so we have a less dense population, but that doesn't mean that in our highly populated areas, which are around Salt Lake City, that they experience a huge opioid epidemic there. Utah currently has around 3.22 million residents and is expected to grow at a significantly higher rate than it has before. The contributing factors and the social determinants of health in opioid misuse and abuse, these can influence opioid misuse and abuse. So social support, if the individual does not have the social support that they need to, they are at a higher risk to misuse opioids. Now, social support can also help them gain control of their addiction and seek help. Access to healthcare services are extremely rare for people with opioids that they misuse. This is because the individuals do not have the money to seek health care when they need it. So they often have things that are undiagnosed and multiple other problems. Job opportunities are also decreased for individuals with opioid misuse and abuse just because they are unable to be reliable or provide themselves with transportation. The availability of resources is limited considering housing. If they're unable to pay for housing, then they become homeless, and that also includes the lack of food and water. Specific concerns relating to the physical well-being of people with opioid misuse and abuse is that they will actually have increased pain and withdrawal symptoms without the use of an opioid. The increased pain stems from their use of the opioid and making it so their pain receptors are more hyperactive. Psychosocial, they have a lack of social environment, meaning that they basically alienate themselves and they do not participate in any family activities, friend activities, any job, socialization. They do not participate because they are unable to. economically, they do have lack of housing. They have a high rate of being homeless. They are always searching for ways to get food, and oftentimes they do not care because the drugs themselves make it so that they do not want the food. And they are also unable to hold a job, as I previously stated. The root causes are increased access to opioids. This includes Utah, as Utah is very high in the opioid epidemic, as we have major freeways that go through our state. The social influence, if a friend is doing it, that individual that is friends with them are more likely to participate as they have easy access to those opioids. And then dependency after a condition. So if someone were to get in a car accident and they broke their leg, the doctor would prescribe them an opioid to help with the pain, but it only takes 4 to 8 weeks for an individual to become full-blown addicted to an opioid. Sometimes it can happen sooner. Maslow's hierarchy of needs is very tricky in this situation because the individual does really not meet any of the tiers. Rather, they are not met at all, considering that they do not have housing, food, water, they're not healthy. So the anticipated functional level, it really depends on the individual specifically. Some individuals are able to function on these opioids as they have increased tolerance, but other individuals become homeless without food, without water, without any resources for them. The likely health outcomes, they have an increased risk for disease, anorexia, and there's studies shown that individuals that misuse and abuse opioids, they have an increased likelihood of getting a mental health disorder. Communicable diseases or infections that these individuals are at risk for include HIV and AIDS from the intravenous route, hepatitis A, B, and C, also from intravenous route. They have an increased risk of STDs due to risky behavior, and also they have an increased risk of tuberculosis due to the homeless aspect of it. Non-communicable diseases or infections also put them at very high risk for getting these. They can experience liver disease. This could be related to hepatitis, or if they are drinking with their opioid use. Sleep disordered breathing comes from actually using the opioids for a long period of time and compromising their respiratory status. Hypoxemia is basically the same reason. Hyperalgesia, this one is huge in this patient population. As I explained before, that the receptors, the pain receptors, have an increased hyperactivity because these individuals have used opioids for so long that their body does not know how to function without them. They also suffer from chronic constipation due to the opioid use. Self-care deficit is huge. These individuals, because they are high all the time or they are just wanting to get high and sleep, they don't exactly care about their hygiene, and it seems that they actually put it off. Same with their nutrition, as they don't have access to food, they don't have money to buy food, and they just generally do not care. They have lack of medical care, as I previously stated, and an increased risk for homelessness. Self-harm is very broad in this aspect because they are risk-taking behavior individuals, meaning that they are abusing their body, and so just taking an opioid for the wrong purpose is a form of self-harm. They also have a greater chance of getting depressed, and it has been shown that individuals that misuse drugs can alter the chemicals in your brain and can actually give you new onset of schizophrenia. risk for harm by or to others, specifically schizophrenia. If these individuals do contract it, that mental health disorder can be very scary as they can have command hallucinations to harm others. Antisocial personality disorder is also really huge in these individuals, and this can mean that they are very manipulative. Anything that they can do to get drugs, they will, even if it harms others. They do also have an increased risk of bipolar disorder, and they also have a high risk of disease transmission, meaning that they will pass on STDs, HIV, AIDS, anything. These are my references. Thanks for listening to my PowerPoint on opioid misuse and abuse. I hope it was very informational. Thank you.